It's Taylor with West Physiotherapy, and in this video I'm going to show you a quick and gentle mobilization for a transition zone in your back. This is between the trunk and the pelvis, so it's an important area that often takes a lot of stress with standing and sitting, and so mobilizing it can be helpful for improving the health of that area. It's also an area where nerves, important autonomic nerves through the bladder, come off. And so keeping this area of our spine healthy may help with that whole bladder and urinary system. Okay. At any time when you're going to start exercising, it's always important to check with your doctor and make sure that it's safe to start a program. If at any point in this you don't feel comfortable or the exercise does not feel good, you have my permission to stop. If you are someone who has severe back pain or symptoms into your legs, then this is something that you would not want to start without some kind of supervision from a trained professional. So the mobilization tool that I'm going to use today is this small chirp wheel, but if you had a foam roll or even a firm to soft ball or something, then you could use that to help you mobilize as well. Anytime we get a little more mobility in an area, then we want to train the muscles around that area to control it. So this is kind of like three parts that are important to our movement system: mechanical capacity or our mobility, our neuromuscular control and strength, and then how we move or our motor control. So when we get mobility, we want to train our body to use it. Otherwise, we're sometimes missing out on a piece. We get the A, we get the C, we're missing out on the B, and that can affect our outcomes. All right, so what I like to do is, because we're talking about this area in the spine, kind of, here's the low back, here's the mid back, kind of talking about this transition zone here. We've got little floating ribs here, so it doesn't usually feel really good to put pressure right around that area of the spine. So what I like to do is mobilize a little bit above, mobilize a little bit below, because we've got muscles crossing this whole area. So if we make some changes above and below, we're kind of starting to get into this region. And then I'm going to show you a nice way to improve some control and mobility with a follow-up exercise. Okay, so you could place the foam roll or this little chirp roll in the middle of your back. And what I like to do is always support my head and neck, and then lift my bottom, my legs are bent, and then just do some rolling and just sort of get comfortable on the roll and move back and forth. And I'm just noticing where does it feel stiff and where might I want to stop and spend a little more time. So I get into a pretty stiff spot that feels harder to backward bend here, so I'm just going to spend a little extra time here bending backwards and stretching out some of this tissue along the front and giving the spine some time to sort of move this way and open up. Okay, I like this or a foam roll too for low back. A lot of times, sometimes people need more backward bending in their back, and sometimes this tissue has gotten tight and compressed and it needs stretched out. So placing this just below the low back can be a way to stretch that out. I would not do this if you have a lot of hypermobility in your pelvis, but you can also bring your knees to your chest. I would also not do this if you have an ongoing disc problem or symptoms down your leg. But this creates some nice traction and some stretching through the low back there, which feels really good. Okay, so once we've kind of mobilized above that transition zone and below the transition zone, okay, then what we're going to do is practice giving that area some rotation and some control. So I'm laying here, legs are bent, and I'm going to gradually let my knees fall over to one side, okay? But I want to talk about how you're going to do this. And this is an exercise that I learned from the Institute of Physical Art. It's a controlled and segmental lower trunk rotation, okay? So instead of letting just this whole thing go all at once, I'm going to notice, can I let my knees start to fall first, and then let my hips start to fall, and then let this middle of my belly start to twist over, and then my rib cage, and then all the way up as far as feels kind of comfortable. Okay, and then on the way back, what a lot of us do is we may lead this movement from distally from the knees up, okay, but we're missing out on a lot of great unisegmental control if we do that. So what I want you to try to do, as long as it feels comfortable, is I want you to try to move from the top down. I want you to think about bringing your rib cage back first, and then the bottom of the rib cage is coming back. You'll feel a lot more engagement through your abdomen, and then your low back is starting to come back to the mat, and then your hips, and then your bottom, and then the very last thing is your knees. Okay? This is the neuromuscular control. This will feel like a brain teaser and an ab workout at the same time. So you're looking for smooth movement, okay, and the ability to kind of you're imagining every level of your spine is moving instead of the whole thing moving as a chunk, all right? And then you're going to try the same thing across in the other direction. So you can see here, instead of leading with my knees, I'm going to try bringing this part of my rib cage to the mat, and then further down. I'm getting a nice stretch through here, into the low back, pelvis, hip, and knee. Okay, I hope you enjoyed that. Thanks a lot.